I know if my child has a habit or has developed a tic? My name is Kravetz. I am a pediatric nurse practitioner at Progressive Pediatrics. And today I would like to talk about habit versus tic. A habit is more of a practice or a behavior. Tics are sudden, rapid, repetitive movements that often begin in childhood. Tics are often referred to as nervous habits and may involve motor movements such as eye blinking, squinting, shoulder shrugging, or they can be a vocalization, including repetitive sounds, grunting, coughing, or sniffing. People who have tics cannot stop their bodies from doing these things. For example, a person with a motor tic might keep blinking over and over again. Or a person with a vocal tic might make a grunting sound unwillingly. Motor tics are sudden, unusual movements. Examples include eye blinking, brief facial grimace that may look angry or as if the person is in pain, shoulder shrugging, head jerks, moving the body in odd ways, sometimes scratching, and making obscene gestures. Vocal tics usually involve unusual sounds or words, throat clearing, swearing, or repeating words or phrasing, such as echoing others. People with tics often know they're going to have a tic before it happens. Tics can also be referred to as Tourette syndrome. Other problems associated with Tourette's include attention deficit disorder, ADHD, obsessive compulsive disorder, anxiety, depression, problems with behaviors such as angry outbursts or aggression, problems with learning, and sleep problems. So how do we diagnose this? There's no test to diagnose tics. It's based on history and a description of symptoms that helps determine the diagnosis. The symptoms of Tourette's can start between the ages of 2 and 15 years old. In about half of those cases, tics go away without any intervention by the time the child reaches 18 years old. Sometimes tics can go away and then return after some time. Treatment. Children with tics don't need medical treatment if their tics are mild. However, if the tics interfere with their activities of daily living, if it lowers their self-esteem, if it keeps the child from participating in age-appropriate activities, or if the behavior is causing pain or self-harm, this is where medical intervention is recommended. So some of the medical interventions include therapy, which focuses on habit reversal training. This treatment involves a therapist who helps the child recognize when the tic is going to occur and then replacing that tic with a different behavior. Another form of treatment involves medication. There are medications that can help calm the tic. At one point in time, stimulants were thought to bring on symptoms, but when used in the right doses, they can also calm the tic. Botox has also been used to help calm the nerve signals that make the muscles jerk or twitch. To learn more about Tourette syndrome, here are some websites which you can check out. Again, my name is Kravetz, pediatric nurse practitioner at Progressive Pediatrics, encouraging you to call with any questions or concerns regarding tics or any other concerns you might have about your child.